name's Natalie Young. This is around November 2021. I've been back in Australia nearly 2 years now. Um, this year alone, I've been thrown out of John Hunter Hospital about 12 times, denied care for chronic, persistent tick-borne disease, immune suppression as a result of being a national park ranger and being bitten by ticks. In my job, infecting my daughter in utero. Sold my house in 2019. I couldn't walk or talk. I have a video of this. I have footage of this. I was in Queensland at the time trying to get help through a GP up there whose nurse was keeping me alive by cannulating my foot, my leg, because I was dehydrated all the time. Cellular dehydration, cellular issues, anemia, which I required red blood transfusion in Mexico under Dr. Morales, hematologist. On arrival to America, Dr. Harris, who was talking to Dr. Morales about my case, I ended up going back to America because I needed certain medications, different testing. Tested for autoimmune encephalitis, positive to GAD65. Took a few months to talk and walk again. By the fourth month, I was walking around San Francisco carrying my own shopping. The heaviness, the pain, the fatigue starting to improve. However, still not well. Had to go home because I didn't have enough treatment money to continue to stay over there. December. Came back, I had a treatment plan from Dr. Harris, Dr. Elena Freed, who I'd seen previously in 2018 in New York just for testing and diagnosis. She became part of my care team to facilitate a treatment plan, a neurologist in New York. Since being back in Australia, by the 6th month I started to deteriorate. Autoimmunity was part of my picture, but they didn't take it on. The infections were part of my picture. I've been to Westmead Hospital. I got told I needed psych meds and they wouldn't see me again unless I saw a psychiatrist and a hematologist. I went and saw a hematologist. He said, I don't know why your blood's hemolyzing. I can't figure it out. I've seen people like you tick sick, but you're the sickest I've seen here. Sorry, I can't help you. Goodbye. Since then, I've seen over probably 20 specialists all refer me to other doctors. Nobody wants to touch me. Tick-borne disease history. As a result of that, I've just continued to deteriorate. I ended up with full hemolysis. I've got pictures of all this. Ended up in the Sands Hospital. Their hematologist said, I don't know what's wrong with you. You got hemolysis. This has just started stressing out. Said, I'm going to send you to Melbourne because, they agreed at the Peter MacCallum Institute I needed my blood cleaned with plasmapheresis and IVIG. There's infectious autoimmune condition. And then the doctor rang Peter MacCallum. He said, we'll try and fly you down there. By the 4th day, I'd been on IV fluids for about 4 days because I was so dehydrated again. He came in and said, I've rung an immunologist. It was one I saw previously about 6 weeks before. And he said, well, he can't help you. It's not his scope. I said, yeah, and he said his name. I said, that's a doctor I saw 6 weeks ago outside of here. And he said, well, I don't know what to do. We'll pass you to psych. So, do you want to stay in for the weekend? We'll take your cannula out. I'll pass you to psych. I said, well, what is the use of that when I've got a condition that's driven by infection and autoimmune? What psych is going to do me? What, they're denying my care and you're denying my care. Well, you can't live like this. No, I can't live like this. And I'm probably going to die like this because this is a continual systemic denial of care of not just me, but other people. But my case is going to go down in history one way or another. I'm probably going to die and I just have to accept it because I've been fighting and it's beating my head up against a wall. I've got immune suppression. They still can't even figure that out. I go into sepsis. They can't figure out because I've got a normal CRP yet. I've still got inflammation and cytokine storms in my body. Constant cytokine storms. I've got mass activation. However, My tryptase is normal, but I do have cytokine storms. The cytokine storms over many, many years have damaged all my neck and spine. Now there's nothing left of my neck. My cartilage is damaged. If you look up what continued chronic persistent inflammation can do and autoimmunity, it can damage bones and tissue, and that's exactly what's happened to me, and it's still happening because the disease process is now being ignored again. I was told to go home from John Hunter Hospital over 12 times. I ended up lying in bed watching films with my daughter and my dad and my family when we were all happy before this illness began, working for national parks. And I just accepted I was going to die because no one was fighting for me. I have no voice. I continually get thrown out of hospitals and blamed as psych, and when I'm really clearly very, very sick person. Just recently I've been to an IV bar in Newcastle and I got accused of being an alcoholic, but I'm not alcoholic at all. I'm just really, really sick. She said, "Oh, you're going into ketone acidosis. You need to go to ER. You need to go to ER. Have you been drinking? No, I haven't drunk alcohol in 15 years and rarely drank it anyway. Wasn't my scene. I surfed. I was healthy before tics. Anyway, I was going back to the John Hunter. They continually threw me out. I ended up in Royal North Shore. A friend drove me there. By the time I couldn't walk, I was travel talking. I was having seizures. Got videos of all this. And I said, I feel like I'm going to die. My CRP was normal, again. My D-dimer was high. My GP actually spoke to Dr. John Hunter and asked him to keep me in because my D-dimer was so high. They laughed at it off and said that test is a week old and that seems quite extreme considering you got no CRP that's high. I ended up at Royal North Shore. I got told by emergency that you can't come here this sick from tick and expect tick-borne disease treatment in emergency. This is an emergency department. I said my condition is related to not being treated from ticks, and now my condition is worsening. I've got an opportunistic infection or something going on in my line. Another doctor tried to get me to sign a waiver to leave, but I wouldn't do it. And finally another good doctor came in after seeing my huge file with what's going on in my body, and he said, "You need a whole team on this to sort this out. You need a whole team." Dr. Hudson was put under Dr. Hudson's care, who originally diagnosed with Lyme in 2009, but didn't follow up my care. As a result, I ended up sicker. Anyway, he came in and said he'd take over my care. He said, "We think you've probably got infection or inflammation, and you've got clots on both your lungs. You'll have to stay in over however long." Ended up the second day, I think it was the neurology team came and said I needed cognitive behavior functional diagnosis by them, and I need cognitive behavior because it's just all in my brain and it's a mental disorder. Anyway, Dr. Hudson started to culture my blood, and 3 days after that, 3 or 4 days after that, it came back to 3 staph infections. The line, he took a picture of the line, had grown calcium deposits of bacteria, and it was almost calcified big chunk of this line here. It was full of infection, causing inflammation, seizures, different things, on top of already what I have, the other disease process and persisting Borrelia, which was proven in Labs 2020, but was denied again. I didn't improve as much as they thought in the hospital, and they practically said, "Well, you're only here for your heart operation." I kept telling my eyesight's getting worse, it's getting worse, it's getting worse. They didn't listen. I was having trouble walking. They brought physio in, pushed me, tried to get me off my walker, but I couldn't get off a walker. And previous to this, when I came back from America, I was walking perfectly along the beach and everything with the right treatments. I was discharged, still unable to walk on a walker, with eyesight problems, continued low white cell counts, some anemia, and different things happening in my bloods. My GP, at the Royal North Shore, my American urologist, Alina Freed, offered to talk to them to guide them through the treatment. She's done a lot of complex cases like mine. They refused. she asked to have my anti-neuronal antibodies tested. I asked them. They said they tried to do them, that the blood was frozen. So that didn't happen. And then when I got out, continued to deteriorate still. My GP ordered the test that Dr. Friedrich had ordered, and it came back positive, anti-neuronal antibodies, recovering IgG linked to paraneoplastic blindness and cancer. Autoimmunity can drive severe neurological symptoms. This has all been ignored. Every time I've gone back to ER, including the Marta and John Hunter, lately they've ignored it again, and they just blame, okay, you've just got, it's so complex, you need to find a specialist, which I've been trying to try and find a specialist for over a year and a half. I'm in extreme pain now, I just don't stop buzzing and tingling. I'm losing my eyesight, my sense of taste, my sense of smell. I'm really white and agitated, and I can't sleep, I can't eat properly. My gastrointestinal system is damaged. My tissues just feel like they're just not elastic, they're not working anymore. I feel just so weak, I feel confused. I'm forgetting things. If you ask the people around me now, I'm losing like my memory at times and things. Sometimes I'm having trouble even talking at times. That's why I'm doing this video now, so everybody knows what's happening. Because this is not right, this is wrong, this is a denial of human rights and care to Australian people that are tick sick. I got this at work. It's a work cover case. I still cannot get care in my country. The DISCAT guidelines are causing harm to Australian patients. And I got a letter for Hunter Area Health while I was in the Royal North Shore fighting to stay alive from staph infections, infective endocarditis, and other things, saying, you should show your GP this. This is the DISCAT guidelines. This is what type of guidelines your GP needs to follow for your care. No, it's not, because tick-borne disease is associated with many co-infections, polymicrobial. It's not one infection, and it's also linked to autoimmunity, which is also being denied care. So where are we supposed to go? And this is what my local hospital tells me. So where do I go for help? The local nurse at the IV bar where I go because I was dehydrated can't even cannulate me. She's an ICU nurse at John Hunter Hospital, and she can't cannulate me and tells me I've got ketone acidosis and I'm dehydrated and I'm really sick. Why won't they help you? Why won't they help me?